and that is fair. All right. Good morning, everyone. Happy Saturday. This is the voice and the face of Dr. Olabintan, CEO and founder of Livingspring Family Medical Center here in the beautiful city of Mansfield, Texas. If you're joining us live, I keep forgetting to do this, hashtag live. If you're joining us on replay, hashtag replay. And we're here again because we're discussing topics that help our patients live long and well, because we believe the quality of life is just as important as the quantity of life. And I am very, very happy today to have the one and the only Dr. Dare Ajibade, who is a cosmetic plastic surgeon in the Washington, D.C. metro area. Now, Dr. Dare and I go way back. We hail from the same medical school, Rutgers. So this is such a privilege and an honor to have you here again. Thank you so much for coming.
Of course, of course.
All right, awesome, awesome. Now, I already mentioned your name, but for those who are watching, can you kindly introduce yourself? Who are you, and what do you do?
Of course. My name is Dare Ajibade. As mentioned, I'm a cosmetic, plastic, and reconstructive surgeon in the DMV area. Uh, Born in Nigeria, I moved to North Jersey, right outside of New York City. Grew up there, went to school there. As mentioned, I actually went to Rutgers undergrad, went to medical school there, graduate school, continued my training through general surgery, and then plastic surgery, cosmetic surgery. Now I'm doing what I love.
Awesome, awesome, awesome. Now, I always like to ask our guests, like, why do you do what you do? What got you interested in plastic surgery?
The My journey is certainly, like most people, a combination of many events. Things that I didn't even think molded and imprinted me when I was younger. I see now that they influenced me, but certainly I think if I was to kind of think back, it started early in my medical training. I did some burn rotation.
Okay.
I saw a lot of people with burn injuries um, that were, after burn, you have a lot of scar. Due to the scar, you need reconstruction, and it really impressed me to see a lot of these people. They will be in the hospital for months, you know, essentially brought back from the brink of death, and they still have this kind of almost like they weren't completely healed even when they've recovered. It wasn't until after the reconstructive surgery with plastic surgery, scar revision, uh, getting rid of tight bands and things like that, they feel complete. And that kind of was in the back of my mind. And I started general surgery. I was doing general surgery, loved everything. I went into surgical oncology. I thought I was going to do surgical oncology.
Wow.
And we started doing a lot of breast cases, a lot of cancer cases. And the same theme kind of repeated itself. People felt completed and their health was completed after reconstruction.
Hmm.
Female, especially young female, after total mastectomy, they didn't feel like themselves. They didn't have their femininity. Some of them just got married. They're not comfortable around their husband. Then you go back and do breast reconstruction, and they're so happy and so complete. You would think that the reconstruction was the cancer surgery in terms of the magnitude of their reaction. And then throughout my training, I see, as we all see, inequality in medicine. Some of the inequality I saw was there's not a lot of minority plastic surgeon. There's not a lot of minority cosmetic surgeon. There's a lot of minority patients did not think they could get plastic surgery. They didn't think it was avoidable. They didn't think it was accessible to them. All
Hmm.
of this kind of started to mold me to steer me towards plastic surgery. And when I got exposed to plastic surgery, it was the delicate balance of the heart and science that really kind of really pushed me. There's certain science to it that you have to abide by, but at the same time, you need a certain level of artistic license to be able to do cosmetic surgery. There's a tons of diversity in terms of you could operate from babies to elderly.
Wow.
You can operate on males and female. you could do from head to toe. That really interested me because I tend to get a little bored sometimes. So the fact that I have something
Right.
always stimulating my mind, and the technology in plastic surgery is always growing. That was really good. And to be honest, I like pretty things, and I like to make things pretty. So
All right, I like that. I like pretty things and I like to make things pretty. But I love how you emphasize, the silhouette, like how the silhouette appears is very important to people. And that's why we're having this discussion. By the way, Miss Denise Epps is watching and she says hi.
it's
Thank you
easy.
for joining. Thanks for joining. All right. So people are asking, we're talking mommy makeovers. You talked about, how much one's perception of their skin or their body sometimes after a traumatic event, and even not after a traumatic event, can affect their outlook on life or even their confidence or how whole they feel. Now we're talking particularly about mommy makeovers. We have patients that come in to see us as primary care doctors and say, I'm going for a mommy makeover, and I'm told I have to come see you. What is a mommy makeover for those who are watching?
Mommy makeover is essentially, for all intent and purposes, it's the restoration of form and function from post pregnancy and childbirth to that time when you used to feel yourself. No one could tell you anything. You know, the breasts are where they're supposed to be. The belly is where it's supposed to be. There's no extra skin, extra fat. Basically, after birth, after having children, your body goes through incredible transformation. And females, especially, 30s, 40s, even 50s, they want to feel a certain sense of youthfulness again. They want to feel like themselves. Um, Maybe the kids are grown. They feel like they've lost a certain zest and they wanted that back. So basically, mommy makeover is whatever combination of surgery specific for you that brings you back to your pre-baby face. So it could be anywhere between facial surgery. um, as we age, it's not just about babies. Also, it's just natural aging process. As
Okay.
we age, the brow comes down a little bit. You have a little extra skin on the upper eyelid, some bags here, extra skin. The mid face comes down a little bit. You have what we call jowling, which is excess kind of skin and tissue here. The neck is a little kind of saggy and turkey neck, as you guys call it. You know, the lip is a little flat. Maybe the nose is not what you want it to be.
Good.
Come down a little bit. You have arms as a extra fat and skin. The breast that you where nipple used to be pointing forward now is kind of gazing down, um, and it's flat up top. Maybe after multiple breastfeeding.
Breastfeeding. Mhm.
Belly, the muscle is a little separated, which pushes the organ out, so it makes the tummy a little protruding. Skin is sagging. There's stretch marks.
You makes having a baby sound so.
It's not just the baby; it's the natural aging process. It's gradual, but I'm here for you. Um,
Oh my goodness.
some people have some tummy tuck, not tummy tuck, C-section scar that
Mhm.
they don't like, things like that. The thigh skin, excess skin, whether it's on the inside or the outside.
Mhm.
The butt is not, it's not given as it used to. It's not up there.
Mhm.
So all of that could be restored
Okay.
through surgery. It could be as non-invasive as Botox and fillers,
Okay.
um, laser. It could be as minimally invasive as tightening of the skin, or a little more invasive as liposuction, or complete all-out surgery as removing skin and tissue. So for the face, we could raise the brow, we could take out skin from the upper lid, uh, readjust the fat so there's no hollowing. Bags, we could fix bag under the eye,
Mhm.
remove excess skin, bring the mid face up so it's not sagging, liposuction and remove excess tissue here, tighten the skin there, raise the lip, fill the lip, skin on the neck, tighten that, remove fat, remove the looseness.
Okay.
Um, the breast, obviously, if you're too small, we can make it big. If you're too big, we can make it small. If it's down, we can bring it up. Um, Anyways, between using fat or using implants or
Okay.
using your own tissue. For the belly, we can liposuction, tighten skin, uh, um, remove excess skin, pull the skin down, do one or the other, or combination of all.
Okay.
The arms and the thighs, we could remove fat, remove skin. Outer thigh, remove fat. The butt, we could add fat to bring it up. We could add implants. So all of this basically is what combination restores you to your ideal
Okay.
person.
Okay. Now,
And that's basically the essence of a mummy makeover.
okay. Thank you. Thank you for explaining. So it varies. It can be anything simple to invasive, and so that leads us to our next question. So what would be the first step for someone who says this is something they want to do? And the whole idea of having this conversation is to encourage people to do it safely, right?
Mhm.
So the person comes to you for a first time visit. What typically, I say two, three things typically happen at that visit on the consult for such a procedure.
Well, I think even before that, before the consult, when you start thinking about surgery, the thing to do is kind of have a good understanding and definition of your own aesthetic goals. Like,
Okay.
what are you looking for? What are you looking forward to? And try to make sure that that aesthetic goal is reasonable, right?
Okay.
I get some people that come in and they look a certain way, which is completely different from the body structure or BMI or just starting point of say Beyonce, but they bring me a picture of Beyonce, they want to look like her. It's like it's not magic. It's still surgery. So you have a reasonable goal, reasonable expectation. That's the first thing to do. And then what you want to do is try to be at your ideal body weight.
Hmm.
Right? Plastic surgery is not a weight loss surgery. And your best outcome is very strongly dependent on where you're starting, right? I could, I can knock something out the park and hit a home run if I'm like already close. You know,
Hmm.
I could be as good as I want to be. If I have to go from 0 to 10, it's a little bit of a harder work than if I have to go from 5 to 10, 8 to 10. So be at your ideal goal. And the important thing about that is if you could start and maintain lifestyle changes that you can stick with after the surgery, you could stay there. It
Hmm.
won't be a struggle and you won't lose the gains that you make in surgery. Uh, a special point for people that do have weight loss surgery, like post bariatric surgery. You want to wait till you lose weight, right? You lose weight and you at a stable weight, right? Typically, that happens around 6 to 9 months after uh, bariatric surgery.
Surgery.
And then you want to give your body to kind of acclimate. It takes about 3 months after that. So you really should wait about 9 to 12 months after bariatric surgery to even consider plastic surgery. Reason being, you don't want to get it and lose all this weight and have more extra skin, and then you don't like the way you look, or you want liposuction and they can't take as much out, and then you lose more weight. It just get to your point, get to your goal, and then you can work from there. And the last thing is research surgeons um, that look like and based on their work and reputation can understand and probably have a close to your aesthetic goals. So
Hmm.
if you guys are on the same page, it's easier to help you achieve your goal. So at the consultation now,
Yes.
typically the things that happen is obviously we do history and physical. And through that, we assess you, we examine you, we basically get a sense of the starting point, right? Where are you starting from? And then we discuss your goals. From your own words, what are you looking for? So here's where we're starting. Where do you want to go? After that, then we make plans. At least for me, I tell you what I think we could achieve,
Okay.
and what are the different procedures, surgeries that we could use to achieve that. And it could be a one stage procedure, it could be a combination procedure, it could
Okay.
be multiple stage procedure, but we'll make that plan at that point. If you agree, then we go through the pre-op, the during, and the post-op instruction and kind of things you need to know. And I'll, answer all your questions and give you some advice on alternatives, benefit, risk. We'll go through the whole gamut. And then you get to go home and think about it, and then you could,
Mhm.
if you want another consult, you could come back. But from there, we start planning your surgery. And as you can see, this could take some time. Um, so it's really important to give yourself time to go through this process, so you don't rush it. About 3 to 6 months when you start thinking about that is when you do the research, find the
Mhm.
person, and I think it's important to look around to people by doing your research, but you don't want to shop around too much. Then you get confused, you get, kind of too many information. So do the preliminary work before you start going around. Pick your top three, top five, and then go. Usually it'll be what they offer and price point. That kind of gives you, the cutoff for who you go with.
Yeah, I tend to tell my patients that to do the research, kind of look around and see patient feedback too. People who have had surgery,
Yeah.
but do your due diligence. And you said you did mention not to get too crazy in doing that. Maybe top three, top five, and then start to narrow it down. I love something that you said is the lifestyle changes are very very important, or the healthy lifestyles you took to get to the weight, the ideal weight before the plastic surgery, you want to maintain even after, so you can keep the effects of the surgery. And
Mhm.
remember, plastic surgery is not a weight loss surgery. Very, very important, so people don't get that confused. And of course, these are medical suggestions. It's important for you to see your doctor to get individualized care tailored to you. All right, so the next question is this. Typically, as a primary care doctor, I'll see them for the pre-surgical clearance. And sometimes the patient's like, I don't know why I have to come see you before I do this. For the sake of those who are watching, as you being the referring doctor to us, sending them to us for the clearance, why do you do those?
So, a few points to keep in mind. Uh, Safety is the number one priority, right? No matter how fine and beautiful you look, I want you safe and healthy at the end of the surgery. Number one. Number two, cosmetic surgery, especially. These are elective surgery, meaning you don't have to get them. You don't need to get them. You want to get them, right? So, and another thing is the failure to plan is you're planning to fail, right? So it's elective surgery. Take your time, do it right. A couple reasons why we get pre-ups. Some are because of requirements, right? Standard of care based on medical community, what we've found to help and maintain safety. They have certain recommendations that we follow. That's one. Two, a lot of people have some comorbidities like other medical condition, diabetes, hypertension, autoimmune disease, um, anemia. We like for you to go to somebody that's familiar with you. They know you. They've been seeing you all along, or managing your specific comorbidities, to be able to say, okay, we need to do this labs, we need to do this maintenance, whatever, maybe change your medication, increase it, decrease it, hold it, add something else, to get you optimized for surgery. So you could go through surgery safely, recover safely, and be healthy and beautiful at the end of the surgery. So some of the things that you might end up getting through this pre-op clearance is, like we said, labs, maybe to check for anemia, or replete some of your low numbers. You might get mammogram if you're around 40 or above for breast surgery to make sure there's no lesion or issues to kind of take care of beforehand. Diabetes, they might tweak your medication a little bit or make sure that at least it's at go, so you don't do anything that will decrease your chance of healing well or fast. Hypertension, make sure your levels are good, thyroid, autoimmune disease. The list go on and on. But the point is, you want to be safe, and you want to, you know, plan appropriately. So, it's really about planning. It's really about safety. That's why we get it.
Awesome. So it's making sure that you're optimized, you're in the best state possible for the surgery to minimize the risk of complications down the line. Awesome. All right.
Anything
So,
we could do to reduce the risk before is always better than trying to fix it
after.
during or at the end.
Okay. Awesome. Awesome. All right. So you already touched on this question. This is my last question where I say 3 tips on how patients prepare for the surgery, say 6 months before. Planning to do the surgery, we're in May, maybe in November. What would you say to start doing now? 3 things to start doing.
Again, number one, define a reasonable aesthetic sense, right? You will be much happier if you have a very defined aesthetic sense that's reasonable, that you want. You could communicate to your surgeon, and that surgeon could help you get to it or at least get close to it.
Sure.
If you're not sure, you want this, you want that, it's hard to make yourself happy. Talk less of a surgeon making you happy. Again, do your research. Look for surgeons that match your aesthetic sense. Make sure they have training and experience that can help you get to your goal. And as mentioned, look at their work, look at reviews about them, talk to patients that work with them. A lot of surgeons, they don't mind. They'll give you patients contact to talk to, that you guys could you know talk about similar goals.
Hmm.
Um, this day and age, most surgeons have social media. It's very easy to find other surgeons' patients on their social media. If you comment on previous surgery or before and after, a lot of patients, they don't mind. They'll love to talk to you.
Hmm.
Um, Give adequate time, as we mentioned. Give yourself easily 3 to 6 months before surgery, right? Depending on the surgery you're doing, don't expect to, like, go in today, get surgery tomorrow. You might need some pre-op clearance. As mentioned with bariatric surgery, you might need to get to a place where your weight is stable.
Hmm.
Um, Again, lifestyles change. Get to a place where you can, people come to me all the time. Should I gain weight? Should I lose weight? I'm like, no, I don't want you to gain or lose weight. I want you to do what you do and what you could do after surgery. Because
Hmm.
if you lose weight and you can't keep it up after surgery, you mess up your surgery. If you gain weight and after surgery, that will also affect your result. You just want to be at a stable place, good maintainable lifestyle change that you could do during, after, and forever. Um, and just one last thing, which is really a hot topic now, is really understand the difference between cost and value. Um,
Hmm. Hmm.
a lot of people, they want cosmetic surgery. They want a $5,000 product for $5. Like, it doesn't work like that. You know, you have to understand your surgeon. Uh, the price they quote for you is not just for the surgery; it's for the pre-op, it's for the nurses, it's for the product, it's for their work, it's for follow up and multiple follow ups after. Some surgeons, like my practice, for the most part, I do revision for without charging you again. That's kind of included in your price. I try not, I do my work so you don't need revision, but most people, like, you'll generally in cosmetic surgery, you see a certain percent of revision depending on what you do. Maybe they need a little bit more liposuction, or they need a little bit more fat grafting, whatever the case is, that's included in some practices similar to mine, and that's included in your price. That's a value. So to look at the cost just on the surface is not really a good idea, because that's what's getting a lot of people in trouble. Going to they want 360 liposuction and BBL, and they're like, oh, my friend got it for 2,500 in Mexico and or the DR, and they go do it and they get in trouble because, one, you can't verify the training of that surgeon, you can't verify the standard in that office or that surgery center. Um, you you have to fly there, which is a cost. You have to stay there, which is a cost. Uh, if you come back, you have any issue, however small it is, you have to fly back. And a lot of these places, when you fly back, they charge you as a new patient. And if you're lucky to see the surgeon that operated on you, some of these places, they don't give you adequate pain medication to go home. So you end up running to the ED to have some general surgeon or trauma surgeon not trained to do plastic surgery to take care of you, or to take out your drain, or to drain your seroma, or to fix opening. Just because you wanted to save a little bit of money, and you end up paying more at the end. And some people, unfortunately, pay very dearly, because it could be, a lot of these complications can be fatal. So just understand cost and value. You don't shop around with your, cardiac surgeon or your surgical oncology, or your, you don't say, hey, I'm going there because it's $2,500. Like, you go to the best, and this is your body. You only have one.
That is very, very important, and a very good note to end on. Value. Very, very, very important. And I've seen some of those where patients will come back in and have complications from the surgery, and can't go back, actually. And so reattempt to reconnect them with plastic surgeons around here to help fix a problem. So please, 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 very, very important. You are of unestimable value. So it's important that you place your body in the hands of someone who is validated.
To on that note, to piggyback on what you said, a lot of plastic surgeons in the U.S. are very reluctant to operate on somebody else's work, especially if it's done outside of the U.S. One, they don't know what they did. Two, if they operate on you, it's not a clean slate. If they try to fix some complication or some things you don't like, the chances that you will be 100% happy is not as good as if they were starting from scratch. And they're very reluctant to take on that liability, because patients don't understand that the reason why you don't have the ideal result that you want is because we're not starting at the ideal place, right? They only look at the last surgery that was done. So that's why people, unfortunately, end up at the hospital with people that are not really trained to do plastic surgery, or not fellowship trained in cosmetic surgery, to do their revision or whatever they need. So really, really important. Plan, take your time. If you have to save the money. Go to somebody you trust that has the training and the ability to do your work, and try to stay away from, just cutting costs.
Awesome, awesome. Thank you so much. This has been very enlightening and very helpful. For those who are watching, please share with those who will find this useful. Now, people are wondering, Doc. They're like, this doc is awesome. He's straight to the point. He answers questions. I like this. Where can people find you?
I'm in the DMV area. I'm with Jamachi Plastics in Silver Spring. We operate around DC, Maryland, and Virginia. I on Instagram, just type in my last name, and Dr. underscore Ajibade, and I'm there. Send me messages, and I answer.
Awesome, awesome. And what I'll do is at the end of the live, I will put that information in the comments so people have access to you. Thank you so much for coming. Nice to see you again. And that's a wrap. Thank you so much.
Pleasure.
All right, awesome. So thank you all for watching. Have a good one. And if you or anyone you know is looking for an awesome, passionate, and thorough family physician here in the Mansfield area, I am she. Have a good one.